going to hear from Dr. Robert Waugh. Dr. Waugh is a reproductive endocrinologist and OBGYN and sees patients, does surgery, and trains residents and fellows at the National Institutes of Health and Walter Reed National Medical Center here in Bethesda, Maryland. Ladies and gentlemen, again, we thank you for being here for this very, very important event, and I would like to call Dr. Waugh forward.
Thank you, and good morning, everyone. It's great to see everybody out here on this warm spring day in Washington, D.C. I want to thank the Nezhat family, and particularly Camran, for inviting me to speak this morning. As Camran said, there's a lot we need to learn about this disorder. We need to know what causes it, how better to recognize it, how best to treat it so our patients can live pain-free and with no worries about their fertility. Most importantly, we need research on all of the above so that someday we may be able to cure or even prevent this debilitating disease. That journey begins here today about ending the silence about endometriosis. If history has taught us anything about women's health issues, it is this. We need to end the silence, indeed the many silences, that prevent our patients from getting the care they need. Not so long ago, it was considered taboo to speak about even the most ordinary aspects of a woman's life. Words like pregnancy and menopause were cloaked in terms like being in the family way or going through the change. Words like breast cancer weren't even mentioned at all. It's hard to imagine today, but there was a time when even discussing a breast lump with your physician would provoke embarrassment and really silence. Indeed, in some parts of the world today, that is still true. Certainly here in the United States, things began to change when families, patients, women, and their physicians started talking about breast cancer loudly, openly, without apology, in many very public ways. And that's what we're here to do today for the millions of women that are suffering in silence from endometriosis. For many, endometriosis is an unknown word. For many more, it's poorly understood. Today, we want to try to demystify the word, sensitizing healthcare professionals and the public, and issuing a battle cry for change. I'm president-elect of the American Medical Association, and at the AMA, we've long been committed to ending the various silences that can undermine our patients' health. Consider the recent history of the uninsured. In the early 2000s, we at the AMA spoke out loudly and clearly to end the plight of the uninsured. We called the campaign Voice for the Uninsured. We gave a voice and a face to the 50 million patients that had no insurance and suffered in silence. And we did this years before the passage of the Affordable Care Act. We could not remain silent about the fact that millions of uninsured Americans lack basic health care access, because we know that people without insurance live sicker and die younger. We also could no longer remain silent about the plight of those who had insurance but still didn't have access to health care because they had pre-existing conditions like endometriosis or because their insurance did not cover preventative care. Because we and so many others spoke out, our nation finally passed health system reform legislation. And today, the ACA, whatever your view on it is, with its imperfections, is doing a lot of good things for our patients, and especially our female patients, including those who live every day in pain because of endometriosis. As everyone here knows, many women suffer silently, often for years, with endometriosis. In some cases, it's because the disease goes undetected, or a treatment plan doesn't work, or because an uninformed health professional doesn't listen or look hard at the facts. But in too many cases, women don't get diagnosed or treated because they never saw a doctor in the first place. Why? Because they lack health insurance or because their plan does not provide them with the care they needed as women. Today, this is finally beginning to change. Since the implementation of the Affordable Care Act, many more patients, many more women have preventative care and specialized care that is so critical to diagnosing and managing endometriosis. Indeed, access will help many women avoid the debilitating pain, infertility, and damage to their reproductive organs that so often occurs when endometriosis goes unrecognized or untreated. In addition to getting coverage for millions of people who did not have health insurance, the ACA also helps protect patients who have insurance, especially women. Some of those protections are, we've eliminated pre-existing conditions, we've eliminated higher premiums just for being a woman, we've eliminated lifetime caps on coverage, and we provided preventative care with no copay, and we provided well women visits now under the new act. All of these will help women suffering from endometriosis by getting diagnosed and treated earlier. So just as the AMA informed and sensitized people to the plight of the uninsured, we need to sensitize them about the pain and suffering of millions of women who have endometriosis as well. We are doing that here today with this march, but we can't stop here. As a community of patients and healthcare professionals, we have to better help the 1 in 10 women who suffer with this disease. This will begin with awareness, but that doesn't stop here either. We don't stop. Today we march, and we march forward. In addition to healthcare access, we also need better patient education, better physician education, better training, and more funding and better research on the prevention and eventual eradication of this debilitating disease. Two strategic goals that we have at the AMA are to improve health outcomes and to improve medical education. So we are here with you in this battle until endometriosis goes full circle and once again becomes a word that few people recognize or understand. And that's because it will no longer exist. Thank you very much.